a scale of 1 to 10, how would you rate Canada's healthcare system?
I would give it a 3. I work for a very big Canadian insurance company, so based on this, I kind of understand the needs of Canadians when it comes to healthcare and healthcare insurance.
What were some of the challenges you encountered while seeking treatment? Could you share your experience?
One of the biggest challenges was when I was diagnosed with a deviated septum of my sinuses right here. I first had to go to see my family doctor, who then recommended I go to see an ear, nose, and throat doctor, so a specialist. And that took a long time. I believe I waited for around 6 months before I was able to see him. So after that, I was referred for more tests and also for a CT scan. So that took about a year before I was able to get all of my tests done. Finally, after all of that, the doctor, the ear and nose and throat specialist, decided that my problem is not big enough and that I will not be getting any surgery. And that was it. I just had to live with it and take medication. So yeah, my experience wasn't that great.
How did this experience impact you or your loved ones?
I have to rely on medication to prevent the pain from my sinuses. Also, my wife has a similar issue to me, so also she went through the whole system and wasn't able to get the care that she needed. That's why I would say, hey, if I want to pay, let me pay to fix my issues, so then I don't have to suffer anymore. But that's not an option in Canada.
The Canadian government spends about $300 billion annually on healthcare. Do you think the amount of money we're spending corresponds to the level of healthcare we're getting?
Unfortunately not. I think that the whole healthcare system is underfunded. We can see a lot of doctors, nurses, and other practitioners going somewhere else, especially the US. So it's not really solving any issues, any problems. I think that the problem is way deeper than we all know it to be. And I think that as citizens, we don't really understand what the real problems of the medical system are.
Prime Minister Justin Trudeau announced that the federal government is prepared to spend even more money on healthcare. Do you think this will mitigate existing issues within our healthcare system?
Yeah, so going back to the first question you asked about money, I don't believe that putting even more money into the system is going to help. What I think is necessary is to just overhaul the system, start thinking about having universal as well as private care side by side, so that if people want, they can pay extra. And that will kind of also alleviate all of the pressures on the current system that we have, so people have choice. Give us choice. I think that's the most important.
Based on your experience, what do you believe were the key failures within our healthcare system that led to its current state?
I think the biggest failure was that a lot of time was spent just going between different physicians and different specialists, as well as waiting to get, important things done like a CT scan. It's as if we don't have enough doctors, which we know we don't. It's as if we don't have enough equipment. Maybe we don't, not sure about that one. But all of the money being spent, I don't think it's spent in the right way, because we actually don't have the capacity to serve the population right now. And then, of course, with the current influx of new immigrants, this is just going to get worse and worse over time. So I think that there has to be a way that we need to solve this first. Accessibility of healthcare is the most important.
As we heard from our guest speaker today, Canada's healthcare system isn't as perfect as we expect it to be. We hope the government can implement changes so Canadians can get the healthcare they deserve. Share your experiences in the comment below. Like and follow for more.